Hi everyone, I am Chris, and I am going to talk to you about bulimia. Um, I'm only doing part A of this. There's not a part B. I did not have a partner. Julia Child said, "People who love to eat are always the best people." Food is such a big part of our lives. We celebrate birthdays with food. We have cake. Holidays are a lot of focus on food. Maybe we're building gingerbread houses or making cookies or going to a turkey dinner. On vacations, we might splurge on pizza and ice cream. But when do these behaviors go from normal to abnormal? And when does something go from just an everyday, normal thing to a problem? And that's kind of what I'm going to discuss now with you. So bulimia is reoccurring episodes of binge eating followed by extreme behaviors to compensate in order to prevent weight gain. So in order for bulimia to be diagnosed, there have to be the following have to be present: a period of time eating more food than most people would eat or consume. And the DSM gives a 2-hour time period of when this is done. Within 2 hours, somebody is eating more food than would be considered normal or regular. And then there's a feeling of not in control while eating. So they can't stop eating. They feel like they can't stop eating. They can't control the amount of what is being eaten. There's also sometimes like kind of an out-of-body experiences. One of the things that I read said about a woman who drove down a strip and there were a bunch of fast food places, and she kind of went through all of her places that she got food from, parked, ate, and didn't even realize what she had eaten or the amount she had eaten until after she ate it, and there were wrappers surrounding her. So it's very much an out of control, almost an out of body experience for some people. Criteria B is the behaviors to compensate or make up for the binge episode focused around prevention of weight gain. So there's a binge, and then following the binge, there's some sort of, I have to make up for that. And the ways that a person does that is through vomiting, which I think most of us think about when they think about bulimia. That was really all I really thought about, was that a person would purge. Misuse of medication, so the person might use laxatives or a diuretic. Fasting, someone might decide they have a binge and then they're not going to eat for 42 hours. Excessive exercise. And the thing about these are it's extreme. So I think everyone, or at least most people, have had a time where they've overindulged, maybe through the holidays, or you're on vacation and you get January 1st or Monday after a holiday, you're getting back on track. So, you're cutting your carbs or you're going to the gym. And those are all within like a normal range. But when it's taken to an excess and to a place that wouldn't be considered a normal range, that's when you could meet the criteria for a diagnosis. And this has the binging and the making up for it has to happen at least one time a week for 3 months. So again, it's not just like over Thanksgiving I ate too much and then I get on the treadmill and it's happening weekly for 3 months. There's a high focus on body shape and weight that would kind of be outside the norm. Maybe the person is weighing themselves several times a day, maybe before a binge, after they do the compensatory action. So there's a lot of focus on measuring themselves, looking in the mirror, again, beyond normal. It also doesn't occur while having episodes of anorexia. So you're not going to be diagnosed at the same time. The severity scale looks at how often a person is compensating weekly for their eating. So mild would be 1 to 3 times a week. For moderate, it's 4 to 7 times a week. Severe, 8 to 13 times a week. Or extreme, 14 more times a week. So extreme would be like pretty much twice a day that these actions are occurring. Some additional things that support a diagnosis is a person is usually normal weight or overweight. So that makes bulimia sometimes hard to spot because you're not going to necessarily notice someone like anorexia. A person is dropping weight rapidly and they're very, very thin. You're not going to necessarily have that with bulimia. The person looks normal. They might be a little overweight, but they're not going to be extreme one way or the other. So they're not going to be extremely thin or they're not going to be extremely overweight. They're just kind of what would be considered normal range. And outside the binges, the person is restrictive in their eating habits. So this person is going to be eating diet food, be eating low-calorie food. There's always going to be a concern about what they're eating and how many calories it has. So they're very focused on that. There are a lot of physical issues that can arise from bulimia. There could be problems with menstruation, esophageal tears, cardiac arrhythmias, gastric rupture. Now, these three are very rare, but they're also potentially fatal. So although they may not happen often, when they do happen, it can be a fatal incident. There's also could become a dependency on laxatives where that you have to use them. And there's also a lot of teeth issues with bulimia from the vomiting. People lose enamel off their teeth. They can actually lose teeth. So that's an issue that a lot of people can have. Bulimia is most common in adolescents and young adults, and the median age is 21. So you're not typically going to have somebody become bulimic before puberty or kind of like older. It's in that pocket of adults and young adolescents. Women are more likely to have the disorder than men. So for every 10 women have bulimia, there's one man who has it. So that can also cause issues for the men who do have it because there might not be a lot of treatment options. It's also kind of maybe more stigmatized. Some of the risk factors around bulimia, or that could lead up to bulimia, are weight concerns. So someone who already has concerns with their weight, low self-esteem, the belief that the thin body is the ideal body, whether that's like an internal belief or externally, if they're living kind of in a world where thinness is pushed. So maybe, pageants or sports or something where it's kind of more pushed, that could also be a little bit of a risk. Childhood sexual and physical abuse, childhood obesity, early onset puberty. You have a girl developing at like 10 years old and nobody else in her class is. Those feelings of shame and things could make her become bulimic just to kind of try to cope with that early puberty. Family history, and there's some genetic things that could make someone more vulnerable to becoming bulimic. Some of the comorbid disorders that go along with bulimia are anxiety disorders, mood disorders, impulse control disorders, and substance abuse disorder. And substance abuse disorder is a big one. Alcohol, diet pills, those kind of things. Alice Francis had some diagnostic tips. There's a lot of embarrassment around the disorder, so trust really needs to be built between the clinician and the client, before that they might be willing to talk about it. He also really recommended bringing other people in on those conversations. And there has to be, after the binge, there has to be some sort of compensation for the binge. Binge eating on its own is a completely different, separate thing. So if they're binging, then there has to be that they're trying to make up for it to that, like I said, to the extreme. He also warned to be cautious of overdiagnosis. And also not to confuse like the periodic overeating, like I said, that we all kind of do in life with bulimia. And he also really wanted people to be careful of not seeing an obese person and assuming that they have bulimia or some sort of eating disorder. Also to check for the use of substance dependency, such as diet pills. And also when you're making a diagnosis it has to be for their current weight, what's currently going on, because again, the back and forth between bulimia and anorexia. A video I wanted to share with you is posted here, and it was just a really good overview of bulimia, a lot of what I've shared, but also kind of outlining a little of the differences between bulimia and anorexia. And it was not very long. I really recommend you go watch it. It's really interesting. And here are some of my references. So I hope that this kind of makes you a little bit more educated on bulimia, and I thank you for your time.